Hello, listeners. Welcome to Views on Health. Tonight on the program, it's a great pleasure to have with me Dr. Indunil Piyadigama, consultant obstetrician and gynecologist from the base hospital in Kahavatta. A long drive to Colombo. Welcome, Doctor, to our studios and SLBC. And for the information of our listeners, the topic under discussion today with Dr. Indunil Piyadigama is uterine prolapse. Over to you, Doctor, to introduce the topic.
Okay. So I thought this will be a very useful topic for the listeners. So basically, to start with, I'll just talk about what is uterine prolapse, or in other words, what is pelvic organ prolapse. So generally, if you take in a woman, the pelvis consists of, there are different structures within the pelvis. As you all know, there's urine bladder, then the rectum, as well as the womb. We call it the uterus in the medical terms. So those are the main structures within a woman's pelvis. So these structures are held in place by different muscles and ligaments that keep them tightly bound to each other and within the given confined space. So what happens is, once these ligaments and muscles get weaker, these organs can move from their original position to a lower position. So basically, they can go into the vagina, and sometimes it might come completely out from the vagina to the outside. So this is in brief called pelvic organ prolapse, or in lay terms, a lot of people call it the uterine prolapse.
How common is this condition?
That is extremely common. That's why I thought of talking about this topic today. So generally speaking, about half of the women over 50 years will have some sort of symptom of pelvic organ prolapse. And so, as I said, they might have some sort of symptom. So proven pelvic organ prolapse, or somebody who has had a surgery for pelvic organ prolapse, if you take all the women above 80s, about 1 in 10 would have had some sort of surgery for a pelvic organ prolapse. So this is one of the commonest problems that we encounter.
Doctor, there are women, I would say the younger ones, say from their late teens and into 20s and 30s,
Yes.
who can conceive and have a baby and life goes on.
Yes.
So you said that when the ligaments and the muscles get weak, that these internal sort of, movements take place and the organ can, come down.
Yes.
And maybe come out totally.
Yes.
In some cases. But what has, like for example, for our information, from a lay perspective, would childbirth and say childbirth in frequency, say somebody might have a baby or two and they're done with it. If for whatever reason a woman has a lot of babies, 5, 6,
Yes.
they do even today, would that lead to this condition?
I think, Fatima, you're spot on the target. I would say the reason behind this. So before trying to explain this, what I would say is there can be a lot of causes that can lead to a pelvic organ prolapse. As I said, it's the laxity of the ligaments and the muscles. So one of the main contributory cause is childbirth. So having a child or carrying a child in the abdomen for like 10 months, you may be carrying about 10 kilos for a long duration of time. That causes some weakness of the muscles. So on top of that, having the baby, vaginal delivery we call it, will stretch all the ligaments and muscles in the pelvis. And also, if it is a very large baby or a very prolonged labor, needed a lot of help from the doctors, so that means you are having a higher risk of having a pelvic organ prolapse. So, but that does not mean that having a cesarean section would prevent a pelvic organ prolapse, because anybody can have an organ prolapse because of this weight they're carrying for the duration. So as you said, if somebody is having 5 children, they will be undergoing the same process for repeatedly. So that makes things much more susceptible or complicated. But not all the women who will have a baby or deliver vaginally will have a pelvic organ prolapse. There are other contributory causes as well. So generally speaking, now you can think about from this childbirth perspective, if there's increased pressure inside the abdominal cavity for a long duration time, that can lead to this sort of problem. So somebody who's having chronic constipation, or somebody who is having a chronic cough, or lifting heavy weights for a long duration time, or any other like tumors or masses inside the within the abdominal cavity, can have the same results, likewise having a pregnancy and having a prolapse. Okay. On the other hand, the hormones have some protective effect. So that's why young females, we generally don't see prolapse. As I said, above 50, it's very common. Why does this happen? Because as life goes on, the hormone levels goes down. Estrogen is the one that keeps all these things bound together. So when a woman gets menopause, estrogen levels goes down, and that can cause ligaments to lax and then lead to prolapse. So these are some of the other reasons that may be contributing all in all. So some of the families also might be having a chance of having more chance of the sister might have than the mother, daughter. So there is some sort of collagen integrity in each and everyone. So depending on that also, that can lead to prolapses.
What is interesting here, doctor, is that it is a condition that is common, but at the same time, how does one detect it? I mean, how would one know that one is having an issue of this nature within the system?
Okay. So that, of course, there are two things to talk about. That is, some women actually may have some sort of a feeling or some kind of a, we call it a symptom, that they're having a prolapse. So those symptoms may be when you wash yourself or when you go to the toilet, you might feel some sort of bulge coming through the vagina. So that is one of the commonest ways that you will feel that there's something wrong. Or else it may be just subtle changes, like somebody might be having a back pain, dragging sensation over a long duration of time. Or another person may be having some sort of urinary problems, that is, you want to pass urine all the time, or if you like, empty urine, but still you feel like you want to have a go again. Or else you go and sit for a long time, but still you can't pass urine. So it may be urinary symptoms that somebody might be having. At the same time, there may be a large group of people who may not have any of these symptoms, but for a routine visit, they go to a doctor, and the doctor might say, you're having some degree of prolapse. So in a way, a person may feel, because of the symptoms, that they're having a prolapse. Or the other way around is, if you go and get checked by a practitioner or a doctor, then they will tell you that you may be having a prolapse.
But this is not going to happen overnight. Again, from our perspective, it just can't, come down within the system. It has, I guess, it's a gradual thing.
Yes.
From that point of view, doctor, how does one detect? I mean, as you say, if some of the symptoms may not be that evident at that stage, unless a doctor can examine and say yes.
Yes, that's true. So if somebody is being examined, like was examined and said that you're having early sort of a prolapse, that is the only way of detecting it before all these symptoms come. Otherwise, because it's a gradual process, you might notice it at a later stage only. But having said that, like, Sri Lanka has a very good sort of a public health system. This is all in all a different topic that I'm talking about. So we invite every woman in their reproductive age up to about 65 to have a smear test done. That is for the cervical smears at the MOH offices. So that is maybe a good way or good screening to detect that you're having a pelvic organ prolapse.
It's possible to detect.
Yes.
So that how often would you recommend this test?
That is, as I said, it's a different kind of topic. At the moment, we recommend every 5 yearly to get it done. That is for the looking for the cervical cancer early lesions.
So within that age group.
Yes.
Right. Thank you, doctor. So now, when you do detect, what happens next?
Okay. So once we detect, there can be several ways of treating this problem. So starting from starting from the simple things, we can change certain lifestyles. So basically, as I said, increase abdominal pressure is a cause for the prolapse. So if you can reduce the abdominal pressure, that'll help. How do you reduce? So you treat constipation. If somebody's having cough and chronically increasing abdominal pressure, you treat that, especially asthmatics. And also talking about the obesity or the weight. When somebody's weight increases, that means inside the belly there's a lot of fat and the weight increases. So reducing the weight will definitely help in further progression of the problem. So that is a simple way that somebody needs to do. Then the second thing, as I said, it's the ligaments plus the muscles that is helping to keep everything together. So if you strengthen the muscles, then maybe you can take off the effects of the ligaments. You can compensate with that. So what we do is, for this, we have a specific exercise. We call it pelvic floor muscle training, where you keep on repetitively contracting the pelvic muscles. So therefore, muscle strength increases, and that will support the structures in addition to the ligament support that is given. So that is the second way. But both these measures that I said will work for prevention and early problems, or the early stage of the disease. When it comes to the later stages, these may not be sufficient. Then comes the other interventions. Out of this, a lot of people might have heard about this called pessary, or the rings that you put in the vagina. About 5-10 years ago, there were long queues for these pessary clinics in general hospitals. That was the kind of the only or the most famous modality that had been used previously. So what is done is, we use synthetic material. It's like a ring where there are different shapes of it, where you use it to obstruct and keep the organs that are coming down to keep in place, that is inserted through the vagina. There are good and bad things about pessaries. So the good thing is it's less invasive. So suppose you are in your 90s and you don't want to do a surgery. So basically this is a simple way. But the drawback is, it's not just you do it and finish it. So basically you will have to come back, because this needs to be repeatedly checked and changed. Because you are not supposed to keep a foreign body in your body for a long period of time. So every 6 monthly, and sometimes some people recommend about 3 monthly. So you take it out and you replace with a new one, or you make some treatment for it and then replace it back. So that is what happens with the pessaries. So you come, you have it, and again you have to have a follow-up where you come back again and again. So the next option is whether you go for a surgery. Surgery depends on what type of a prolapse the person may be having. So we call it may be a anterior prolapse or a posterior prolapse in medical terms, or a central prolapse. So essentially what that means is, it may be just the bladder that is coming out, or it may be just the uterus that is coming out, or the rectum, or everything together. Depending on the compartment and your age, we can decide on what sort of surgery that we can do.
What does the surgery entail? Does it mean removing of the womb, or is something some sort of a repair, can I put in quotes?
Yes.
From a lay perspective.
It's a good question.
Job
I mean, like
done.
you're asking questions like I would say a real doctor. So basically, removing the womb will not have any effect on the fact that there's a prolapse. What we need to do is to strengthen all this fascia so that it doesn't come back again. So basically what we do is a repair. So at the same time, older lady would not have any benefit of keeping the womb. It's just an additional burden, I would say, if you're not planning for a childbirth and all this. So at the same time, we might take off the womb while we are doing the operation, but essentially it's a repair that is being done. So what do I mean by a repair? Repair is there are a lot of fascia and ligaments that are surrounding this area. So what we do is we identify each and every fascia and ligaments, and we try to strengthen them artificially by surgical methods. So there are different approaches. Sometimes it may be done through the vagina, so that is from down below. Or sometimes it may be done by a cut in the abdomen, or else in the newer methods we also do it through the keyhole surgeries. That is, you make a small hole near the belly button where you put a camera in, and then you do the surgery within using long instruments with small tiny cuts. So all these options are available for a repair.
So in other words, the surgeon, meaning the gynecologist,
Yes.
decides what is best. So would you discuss it with the patient beforehand and tell her,
Of course,
this is the sort of method I would recommend? If the patient has a say, and maybe doctor, I don't want this, could you do this? What happens?
Of course. That is how the discussion goes on. So basically, whether to go for a surgery or whether to go for conservative management, it all depends on the patient's wishes and also their fitness for surgery. And then what type of surgery that we are going to do is also depending on the patient's wishes. Because although I have not been talking about this entity, sometimes people in their late 30s or early 40s may also get a prolapse, but still they would want children. So it's a completely different approach or a surgical procedure for them. So this is a tailor-made procedure for different sort of needs and different type of prolapses. As I said, bladder prolapse may not be treated as same as the rectum prolapse. So it's different type of modalities that is being used.
Doctor, one thing you mentioned a while ago was like some of the causes could be like carrying weight. Could you explain that? I mean, weight in what sense? What are you referring to? Is it objects or what are you referring?
So basically, the problem is keeping the abdominal pressure at a higher level for a longer period of time. So if somebody is carrying heavy weights, so somebody is moving their flower pots from some places, so you will be carrying a certain amount of weight and you'll be keeping on your tummy muscles contracted. So that way you will increase the intra-abdominal pressure. So that sort of thing might lead to problems. So basically what happens is, suppose you're somebody who is fit, you do regular exercises, you do your pelvic floor muscle training, you have your muscles kept at a certain level of strength, then carrying a big weight would not really have any effect on that person. But suppose you are a person who doesn't really do a lot of exercises, but suddenly you decide to go on and lift something, or you do some heavy work all of a sudden without strengthening all the muscles that are around that area, then you have a higher chance of prolapsing.
Would females who indulge in sports or engage in sports, regularly, and depending on the type of sport, of course, also have any issues in this regard? Would certain sports give that amount of sort of added stress to the muscles?
In my personal experience, I have not encountered anybody who is doing sports coming with a prolapse. It's mainly, mostly, or almost always, it's people who are not engaged in any sort of physical activity who come with this sort of problems.
Thank you, Doctor. I was wondering because, say, games like, say, basketball, netball, where they sort of have to jump up and down and, and they land on their feet, on a regular basis. They're always on the move, basketball especially. I was just wondering whether any of those sports could, in the long term, have some sort of effect. They do it when they are young, of course, but in later years, whether that would have any impact on the womb.
I do not think so. Basically, I think it's mostly a protective effect that they will have. Because when you are engaged in a sport, what happens is generally there's a surge of growth hormones and other hormones in the body which are very anabolic. So basically, if you do running and do some sort of exercise, it will not only affect on those groups of muscles, but entirely the total body, the muscles will be strengthened. So somebody who was engaged in sports will have a stronger start for their muscles. So the basically starting point will be much better. So their chances of prolapsing is much less.
Doctor, just a question of once post-surgery, would it settle the problem or can it recur?
That is also a very good question. So as I said, this is a process of repair. So it's not like the structure that you will have from the beginning. So it's a repair process. So most of the time, this might work out well, but sometimes there is a risk that it can recur back. So this is a common complication of surgery for prolapses. And what I mean is, suppose now, as I said, there is a problem in the anterior wall of the vagina where you repair the anterior wall. So when you do that, it might weaken the posterior wall and you might get another prolapse on the posterior wall. So on the other hand, it may be the anterior wall again that might prolapse depending on the strength of the tissues that are brought together. So that way, there is always a chance of recurrence. But I wouldn't say it's very high. There is a chance, and there are several other procedures that we can offer in this sort of a situation. So we usually use one's own body to do the repair process. That is, one's native tissues are used to do the repair process. But suppose somebody is having recurrence of prolapse after doing this, that is not sufficient, then we might need to use certain synthetic material to do the repair process.
Dr. Time is catching up with us. Just one final question. If it's a younger person who's still menstruating, will that have any impact? The fact that this condition is in the system, there is a uterine sort of prolapse taking place within, and then the menstruation cycle goes on. Will there be any sort of undue discomfort or any sort of anything like maybe additional bleeding?
Generally not. Because if you really take the anatomy and the hormonal changes that happens for the menstruation, it does not have any effect on the position of the organ itself. But of course, because of the change in the position, there may be problems with the blood supply and the venous drainage for the organ that might have some effect, like a dragging sensation or pain all the time, not only during the menstruation.
Thank you, doctor. So what's your take-home message?
So basically, what I could say is pelvic organ prolapse is a very common condition where a lot of people above 50 will have some sort of symptoms. So the way to get to know early is just by asking a doctor to have a look and get it checked at what stage that you are in. If you are in an early stage of the pelvic organ prolapse, there's always different types of conservative measures and especially exercises that can strengthen the muscles around the area so that it can prevent further progression of the disease. But if you have full-blown disease, then the options that are available will be limited, where either you go for conservative things like ring pessaries or definitive procedure like a surgery.
Thank you, doctor. And there we end this very interesting discussion on uterine prolapse. And thank you to you, Dr. Indunil Piyadigama, consultant obstetrician and gynecologist, Base Hospital, Kahavatta, for being with us on the program and sharing your expert knowledge with us on this topic. Thank you, Doctor.
Thank you very much.
My thanks also go to Nadira Manamperi for technical assistance. I'm Fatima Razi Khader saying good night and looking forward to your company next Monday, same time on Views on Health.